Good morning to everyone who is joining us today. Welcome to all school students, teachers, parents from all around Malaysia, not forgetting all UMS students and staff present in this webinar session. Thank you, and we meet again for today's session of STEM Speaker Series or 3S. For your information, 3S is a collaboration between Sains UMS and my STEM Ambassador UMS. My name is Eda Shawati binti Rakim. I am from Science UMS, will be in charge as the moderator for the session. For those who join us for the first time, this STEM speaker series is a co-joint effort with Faculty of Medicine and Health Science UMS. This program is fully supported by the Sabah Ministry of Science, Technology, and Innovation, aimed to deliver unique and interesting STEM topics designed by subject matter experts to increase the interest of school students, teachers, and community alike to venture in the fields of STEM. For any questions from the audience, please feel free to drop your question on the chat box at the right side of this YouTube live session. Please be informed that for today's session, e-certificate will be given to school students and UMS students. Therefore, I would like everyone to stay tuned with us to fill the form given through link that will be shared at the end of the session. Before we started, I would like to introduce our speaker. With us today is Dr. Alvin Oliver Payus. Dr. Alvin is a local Sabahan and is currently an internal medicine specialist and a senior lecturer in the Faculty of Medicine and Health Science UMS. He is also the current head of medicine department in the faculty. He was a student in SRK Sacred Heart and SM Maktab Sabah. He was the second batch of medical program in the UMS and graduated in 2009. He later obtained his membership of Royal College of Physicians (MRCP) in United Kingdom in 2017. Dr. Alvin have practiced medicine for more than 10 years and have experience working in multiple hospitals, including Hospital Queen Elizabeth, Hospital Wanita dan Kanak-Kanak Sabah, District Hospitals, and Hospital Chancellor Tuanku Mukhlis or HUKM. He has a strong interest in neurology and have been actively sharing his knowledge to medical students and junior doctors. Dr. Alvin is an active member of Malaysian Society of Neuroscience. He has presented multiple studies and articles related to stroke and other neurological conditions in the national and international conference. He also has published many articles related to neurology in high-index journal and has collaborated with many other esteemed neurologists in the country. He has several ongoing research related to the neurology. He was awarded the Certificate of Excellence for High Impact Publication by the Faculty of Medicine and Health Science UMS for the year 2020 and 2021. He was also awarded Anugerah Perkhidmatan Cemerlang UMS in the year 2021. So without further ado, please welcome Dr. Alvin with his topics entitled What is Stroke, Myth and Truth. Doctor, please be invited.
Thank you very much, Ms. Erda, for the kind introduction. And thank you to Sains UMS for kindly enough to invite me this morning to give this talk. It's a great pleasure for me and it's a great honor. The topic of my talk today is what is stroke, myth versus truth. So I hope that this normally my talk will be interactive session, but because this is online, so it's a bit difficult to make it interactive, but I'll try to make it as interesting as I can. So my talk will have two components, two parts. One, I will talk about what is stroke, where we will briefly revise what we know about stroke. And then the second part will be a more interesting one, where we will talk about what is the myth or the common misconception about stroke and what is the truth behind it. So let us jump straight away to the definition. What is stroke? So stroke is a condition where the blood that's supplied to any part of the brain, it is cut off It can be due to block, or it can be due to the blood that leak out the blood vessels. So as we know, the blood is the one that carries the oxygen and also the glucose. The glucose is the nutrient to any cells in the body. So what happens if this blood flow to the brain is blocked? This causes the tissue, the cells in the brain to die off. Now, these are the things that happen in stroke. These are the fundamental in stroke. So just look at we're going to look at the blood supply, the blood vessel supply that brings the blood to the brain. It comes from the heart, and then after that, after it reaching to the brain, it divides into two. One we call it the anterior, which is in the front. One is posterior, which is at the back. Now, I'm sure you also remember in school where they taught us that the brain have three components, which is the cerebrum, and then the cerebellum, and then the last time I remember during my time they call it medulla oblongata. Medulla oblongata is one of the three components of the brainstem, which is the third part of the brain. The other two parts is the midbrain and also the pons. So these are the blood vessels that carry the blood to the brain. So what happened in stroke is that this blood supply, the blood flow become blocked or become disrupted or become cut off. So the part of the brain that is supplied by that blood vessel cannot get enough oxygen, cannot get enough glucose or nutrients, so they die off. So what can cause this? It can due to block, due to whatever reason. Normally it is due to when there's a clot that happens in other part of the body, and then after that, the clot will slowly progress, follow the blood until it cannot, it cannot go past it, because the blood vessel is not all have the same diameter. Some will be bigger, some will be smaller. So once it reached to one part of the body, it becomes smaller and smaller, and then it become blocked. Or it can also be due to clot. Clot is due to a process where we normally hear why they call it atherosclerosis or atherothrombosis, where there's a deposition of fat in the blood vessel. Or it can also be due to the blood that leaks out from the blood vessel. It can be due to the rupture, or the blood vessel become balloon up, and then it the blood become leak out from the ruptured balloon. We call it aneurysm. Or it can be due to torn off, what we call it a dissection. So all this is the common cause of stroke, because these will cut off the blood flow to the part of the brain. Now, we normally hear that people say that stroke is usually only, the signs will be one part of the body unable to move or become weak or immobilized. So this is not necessarily the case. Maybe it is the most common presentation, but not every cases of stroke will have that. It depends on which part of the brain is affected. For example, if the front part, we call it the frontal lobe, is affected, we can see that the main function of the frontal lobe, the front part of the brain, is the movement, and also when to talk, to speak, and also to our judgment making. And if you look at the back here, we call it occipital, there's not much of a movement, but it controls our visions and also our perception of colors. If you go a little bit down here, which is the cerebellum, it controls our balance and also the movement of fine motor. So not every stroke cases will come in with a stroke or with a weakness of one half of the body. It depends on which part of the brain is affected. So that's all about my first part of the lecture. I mean, to my part of this talk. Second part will be with more interesting, which is what is the myth and what is the truth about stroke. Now, we often hear or read in the social media about stroke. People tend to viral or tend to send a lot of messages telling about stroke, especially the treatment. these in WhatsApp, in the Facebook, or in the Instagram. So, but we don't know which one is true, which one is hoax. So the next part of my talk will be try to untangle, or we try to go through some of the misconception, the common misconception or misinterpretation about stroke that I normally read in the social media. So what is the myth number one? Only older people can get stroke. So is this true? I'm sharing the two pictures which I get from the internet. So if you look at here, both are older people. If you look at the picture on the left-hand side, here you can see the face become drop, it could droop, or asymmetry, because it become not symmetrical, because the right side become weak. So is it true only older people can get stroke? So if a younger patient came in with this face, normally we will say that, oh, this is unlikely to be stroke because you are young. So is this true? These are not. This is wrong. I'm sharing another two picture of a young lady who came in with a stroke. So stroke, the truth is stroke can happen at any age. Of course, the causes of the stroke in younger patient will not be the same as the causes of stroke in the older patient. The older patient may be the causes commonly due to atherosclerosis, where there's a fat deposition, we call it a plaque in the blood vessel, in the diameter, where it becomes narrow and narrow, and then become blocked. Whereas in the much younger patient, the causes might be due to a clot. The clot can be from any part of the body. For instance, commonly in the heart, maybe due to a condition we call it atrial fibrillation. It's a fancy name, but what it is actually is just a heart rhythm. The heart pumping is not regular, it's irregular. So if it disrupts the blood flow in the heart, and it forms a clot, this blood clot can dislodge any part of the body, commonly in the brain. So it will block the blood flow in the brain. So what it causes? It causes stroke. So the truth number one is that stroke can happen at any age. So myth number two. These are very interesting things that I normally read I normally share actually in the social media. So if somebody have a stroke, or somebody your family member or relative have a stroke, immediately we need to poke our fingers, take out all 10 fingers actually, take out as much of blood as you can, and also take blood from the earlobes. So they said in the message in the social media, they said by doing this, you can reverse the stroke. So is this true? It's false. It's wrong. So the truth is, stroke cannot be reversed by taking out blood, by poking or pricking your fingers, all fingers, and also your earlobes. So I'm using this picture of this water pipe. I will illustrate by using water pipe when I want to discuss or want to talk about blood vessels in the body. So for example, this water pipe here in the middle one is blocked. This part here is blocked, the one that supplied the middle house. So whether it is blocked or is it leak, but whatever it is, the water supply to the house is cut off. So using this theory, behind the theory of poking our fingers, taking as much as blood as we can, or the earlobes, we using this theory, we are trying to continue the supply of water in this middle house by taking as much water as we can from this side. So using this theory, is it logical that by doing this, we can settle the problem of water cut off from this middle house? It is not. It is not logical. It cannot be helped. So the only way we want to help to continue the water supply to this house is try to take out the block, or we patch off the water leakage. Same goes with the brain. If the block or the blood leak in the blood vessel in that supply to the brain, by taking out blood from the finger or from the earlobe, will not settle the problem with the leak or block. Okay, this is very important because we on and off we will get the patient when they had a stroke, instead of going to the hospital to get the treatment, they're wasting time by doing unnecessary things. For example, they're doing their best to take out as much blood they can from the finger or from the earlobe, but they miss their time to get the appropriate treatment because in stroke, time is brand. I'm just sharing this. I promise you this is going to be the only slide that have numbers with the statistics. So I'm just sharing this study. So they said that if a patient come in the first hour of stroke, we give them the appropriate treatment. The first hour of stroke, the chances of full recovery will be higher compared to the late presentation. And if you give the appropriate treatment within the first 3 hours, the chances of recovery from the symptoms with no disability is higher. In fact, the study said that the brain become older by the hours. For example, they said that every hour after stroke, after block of the cut off from the blood supply, the brain become older by 3.6 hours. So meaning that after 4 hours of stroke, the brain become older by 12 or 14 years. The second picture here, also taken from another study where they look at the MRI. So they want to see how big is the cell, how is the cell in the brain is affected after stroke. So they look at the MRI of a various patients, those that came in at the 10 minutes, within the first hour, within the 6 hours, within the third hours. So they see that the first 10 minutes, this only small percentage of the cell is affected and died. The red color here, to bring the cell, is island of dead cells. So the first hour, the island become bigger, third hours it become bigger, and then the 6 hour it become massive. The bigger the dead cells, the worse the symptoms is. And then we call it the prognosis. Prognosis means the outcome become worse. And that goes together with the what do you call it? The probability to respond to treatment. So myth number 3, early signs of stroke cannot be identified, meaning that patient can only be recognized having stroke when they have massive weakness or when they come in unconscious. So is this true? It's wrong. Okay, so early signs of stroke can be identified. That's why we often educate the public about FAST. I'm sure some of you have heard about FAST before. So F stands for face, meaning that weakness recognized over the face. If you look at the picture that I showed in the beginning, the face of the older people, the older gentleman just now, will become not symmetrical. We call it drooping. A stands for arms, when there's a weakness of the arms or the leg. Speech means it's difficulty to talk or difficulty to understand what other people talk, or when there's incomprehensible, they call it, meaning that the talk is inappropriate, or they call it a confused conversation. Depends on which part of the brain is affected. If you remember the picture I showed in the beginning, so if it affects the frontal part, which is the front part of the brain, it affects your speech. And then T stands for time, meaning that we need to call the ambulance, or we need to we need to go to get the medical attention to get a diagnosis and treatment as fast as we can. So because that our continuous understanding about stroke, so we upgrade not only fast, so we add on BE, so be fast. So B stands for balance, because we all know that not every stroke will come in with weaknesses. Not every stroke come in with a difficulty to talk. If the stroke happens at the back of the brain, which is we call it the posterior is now, it can only affect the balance. It can only give you a dizziness, but it is a stroke. You need to treat it, because if not, it become worse. And it also can happen, it can give you a headache. They call it a thunderclap headache. This is due to a blood that leaks, a stroke, which you call it a hemorrhagic stroke, and blood that leaks out and goes to some part of your brain. They call it a subarachnoid space. So thunderclap means is the sudden, immediately you have the worst headache. The intensity of the headache, it is the severe, it's a very bad headache that occurs almost immediately. And then E stands for eyes. Like the picture I showed just now, if it occurs at the occipital area, it can affect you vision. So either you lost your eyesight or your eyes immediately become blurred. So from this, we know that early signs of stroke can be identified. So we need to educate ourselves, we need to educate our family, our relatives, our friends. If any of these signs occur, we need to go to the hospital to get the medical attention, to get the appropriate diagnosis and treatment. So myth number 4, stroke can be prevented by taking medication which cause blood thinning, or we call it blood thinning medication. So what I mean here is that if taking the medication over the counter without any doctor's advice. So is this true? This is false, wrong. Okay, because what I mean here is that if you're taking the medication without doctor's advice, or take it as a primary prevention. Primary prevention meaning that you do not have a stroke before, you do not have any risk to take the medication, but because you know that stroke due to blood clot, stroke is due to the blood become clogged because of atherosclerosis. So you want to make your blood become thin so that the blood does not clot easily. But it is wrong because if you take this medication over the counter without any doctor's advice, it causes more harm than benefit. It will cause harmful, it will not help you. For example, I showed this picture of a city brand of a patient who take this medication and then after that it developed bleed, a bleed type of stroke. Because this gentleman is a young patient and then he's taking the medication without doctor's advice and then it bleeds. So he developed a stroke by taking the medication. So the truth is if you're taking this medication over the counter without doctor's advice and as a primary prevention, it causes more harm. So myth number 5, stroke cannot be prevented, meaning that if you have a risk, you will have a stroke. For example, if you have a family member, you have a stroke, you have a stroke. You're going to have a stroke. There's something that you cannot prevent. You will have a stroke. And then if you become older, then this is something that you cannot prevent. So is this true? It is wrong. Of course, there are certain things that we cannot modify. For example, if you have a family history, meaning that one of your family members have a stroke, yes, the chances of you having a stroke is higher compared to other people, but not necessarily that you will have the stroke. There are certain things that we can control, other risk factors that we can control. For example, we keep our blood pressure at the optimum level, we keep our cholesterol level at the normal level, we don't smoke. As we know, cigarette smoking is a major risk factor to any cardiovascular diseases, not only to the brain, but also to the heart and also to other parts of the body. And also we try to keep our body mass index at the optimum level to prevent obesity. And also we try to keep our blood glucose level optimum to prevent diabetes. As we know, the blood sugar is also a major risk factor to have diseases for the vessels, like the brain, the heart, and also to apply healthy diet. But these are all just to name a few. There are other risk factors that we can control. So the truth is, strokes can be prevented if we do apply a healthy lifestyle. So myth number 6. If you look at the stroke patient cannot be recovered from the weaknesses, and all stroke will be bedbound or immobilized. If you look at this picture, I'm sharing these two pictures also I got from the internet. One is an older patient, one is a younger patient. Both of them are bedbound. They're immobilized. So does this mean that if any patient have a stroke will have to cannot recover from the weakness? Does that mean that all of them will be bound to bed? No, it's wrong. I'm sharing these two pictures I got, which is where they share their success story. So I'm sharing this picture of the first lady on the left hand side. This lady had a stroke. It's a young lady who have a stroke. Then because of the blood vessel in her brain becomes swollen and it disrupts the blood flow to the brain. It causes stroke. So she had a stroke and she got a weakness on one half of the body. So, but she has been very committed to her physiotherapy. She has been very committed to her training, and then she recovered. She has no weakness, and then now she's become a very active member of. Now she's become a tutor or instructor of of yoga in her what do you call daughter in her daughter schools. So it's a very success story. On the right hand side is a picture of older gentleman. He still needs assistance, yes, but when he came in with the stroke, it is much worse. He have a dense weakness. Dense weakness means it's a very bad, very severe weakness. He cannot even sit up from the bed. But with the committed physiotherapy, with rehab, with the help from a rehabilitation, stroke rehabilitation unit, he now he able to walk with assistance, yes, but of course, if given the time, I'm sure that later on he can walk, he become more independent. So the truth is, stroke patient can recover from the weakness, and not all stroke patient will be bedbound or immobilized. So we're going to the last myth actually, so a bit fast. So the myth number 7 is that this is the most important one actually. So if symptoms goes away, there's no need to see a doctor. I'm sure you're on and off, or you frequently hear about the story where whether your friends, relative, or your own relative, for example, they came in with a sudden, immediate, like a signs of weakness of one part of the body, whether it's a face or hand. Immediately it comes, and almost immediately also it goes. So it goes maybe within the first minute, it goes away within the next 5 minutes, or maybe it can goes away immediately. It goes maybe in total recovery, or maybe it goes with a partial recovery, meaning that it recovers maybe half, and then after that, within the next 24 hours, then it becomes total recovery. So if you have this, or if your family members or your relative or your friends have this, do you still need to see a doctor? Or you can say that, oh, there's no problem because the symptoms already go away fully. So it's wrong. So if the symptoms goes away, you still need to see a doctor. You still need to get a diagnosis, and you still need to get a treatment. So this condition is what we call minor stroke, or we call it transient ischemic attack. It is a major risk factor, a major risk of developing major stroke in the future. It's not in the future, but in the near future, we call it. So what happened actually in this condition, there is a block in the blood vessel also, but the block is there's there's a block, but it's not a total block. So there is a small amount of space where the blood can still flow and supply to the brain tissue. But if you given a time, the block can become worse and it become a total block. And what happened if it's a total block? It causes the cell become dead, and then it causes a massive stroke. And studies have shown that stroke that caused in a patient with history or previously had a minor stroke, when they have a full-blown stroke, the stroke is worse. The weakness is more severe, means it is bad. So if the patient, if the or your family member have this condition, they call it a minor stroke or transient ischemic attack. It's like um, not to say a gift, but it's a second chance. Maybe a God give you help you to God like tell you that want to tell that you have this condition in your body. You better go and see the doctor, get the treatment to prevent you from this condition become worse, to become more severe. It's a now or never, they call it. Because if we get this and we give you appropriate treatment, we can prevent a major stroke to happen. So to take home message from my talk, so these are the 7 truths of stroke that I'm sharing in my talk today. Stroke can happen at any age. So if somebody you know or yourself came in, you develop a signs of weakness over the face or weakness over the hand, it can be stroke. Although you're young, it doesn't mean that, oh, you're young, this is not a stroke. Maybe something else. Maybe not. It's not. Maybe it is not too sinister. Maybe it's just a trivial cause. No, it can still be a stroke. But of course, the causes can be different. Not maybe it's not due to the age. We call it age-related causes. For example, atherosclerosis. But maybe you have an irregular heartbeat, which we need to check. We can give you appropriate treatment. We can give you treatment to prevent stroke, or maybe become a more worse, or become a more severe stroke. Stroke cannot be reversed by pricking or picking or poking your fingers and earlobe, like the picture I showed just now. Do not waste time of doing unnecessary things. If you have a stroke or your family member, whoever, have a stroke, you have the signs, go to the hospital, get the diagnosis, and get the appropriate treatment because time is brain. If you miss the boat, the more you wait, the more brain cells is going to die, and then your brain function become lesser and lesser. So truth number three, early signs of stroke can be identified. Always remember the B fast. Try to educate your family member, try to educate your friends. The B fast, B stands for balance, where you can present with a loss of balance or you can present with headache or dizziness. E stands for the eye, whether you have a total loss of eyesight or it's just a blurring of vision. F stands for the face. Remember the face picture I showed just now? The face become droop or become, you can see the face become asymmetrical, they call it, not symmetry, asymmetrical, they call it. And then arms become, A stands for arms, where the arm become weak, whether it is at the hand or at the leg. S means the speech. Speech means the difficulty to talk, or we cannot understand the talk, or whatever the person say. And of course, T means time, because time is brand. So need to go to the hospital or call the ambulance. So truth number four, taking blood thinning medication over the counter are harmful. Do not take this medication without doctor prescriptions, especially when you're taking this as a primary prevention, when you don't have any risk factor, you do not have any stroke before. You need to get the doctor's advice because this can give more harm. It can even give you a stroke instead. You want to take it to prevent stroke, but actually it will give you a stroke. Truth number five, stroke can be prevented if you apply a healthy lifestyle. For example, you exercise maybe 150 minutes per week. That is the recommended hours. Means it's just a brief exercise, like a what do you call non-intense exercise. For example, just walking or swimming or cycling, or 75 minutes per week for intense exercise. For example, playing footballs and so on. Brisk walking. Truth number six, stroke can be recovered from weakness. Not every stroke patient will be bedbound. Always remember this. So, for example, if you have a stroke or your family member have a stroke, you need to tell them do not lose hope. Commit to the exercise, commit to the physiotherapy. They one day they still can recover from the weakness. Of course, not every cases will be the same. It depends on the severity, but I'm sure if by doing committed exercise, they will have some recovery from the weakness. They will not be bedbound. And the last truth is that if this is the most important one, if the symptoms goes away, for example, the weakness, you recover from the weakness, doesn't mean that you're already well. You still need to go see the doctor to get a diagnosis, to get a CT brand, or at least to see if you are having a minor stroke or not. And if you have a minor stroke, these are a risk factor of having a major stroke in the near future. So you need to get a treatment. You need to take medication from a doctor to prevent you from get a major stroke. Minor stroke is normally we tell our patient is a gift to the patient because as we know, most patients who have a stroke they came in when they already have the cell in the brain already dead. So mean they already have a sign. So a minor stroke, or we call it transient ischemic attack, the brain tissue is still alive, but they show a sign So we still can give medication to treat. So if you lose this both, you will present when you the brain in the cells in the brain is already dead. So this is my second last slide. Just want to tell you all on the October 29, which is 15 days from now, is a World Stroke Day. So that's it. Thank you very much. Back to you, Erda.
Thank you very much, Dr. Alvin. It was a very interesting and wonderful topic and very well presented. We invite for some questions to be answered by our speaker that was sent to us during the presentation. So the first question is from me, myself. I want to know, doctor, is there any cases of stroke in a baby? And if yes, what is the symptoms?
Yes. Okay. So stroke in a baby. Yes, there is a cases where baby have a stroke. Of course, the causes is not the same. It's not because of cholesterol. It's not because of high blood pressure. It can be due to infection, or it can be due to, for example, when the newborn, because when they are delivered, they have a they call it hypoxia. They call it when there's not enough oxygen. So because maybe difficulty during the delivery, so part of the brain unable to get enough oxygen, so they die off. So it's also a stroke. So this what are the signs, right? You said just now what are presentation. So in the baby, it's a bit difficult to tell. It's not because they cannot tell that, oh, my hand is weak. But you can see that the baby, they are not moving that hand much, for example. Or maybe if you look at the stroke patient, they are weak, but when you assess them, they are hyper. They call it hyper. The reflex is hyper, means that the reflex is more intense, more brisk than the normal side. And then the tone is also, we call it hypotonia, means the tone is also increased. So when you when you assess this baby, you can tell that the reflex is more brisk and the tone is also increased, and they're not moving that hand much.
Oh, I see. Thank you, doctor. So, I have one more questions. What is the most severe kind of stroke?
The most severe kind of stroke is, of course, if a massive one. If you remember the picture I show from the heart, the blood vessel from the heart, it goes to the brain, right? It have two parts. There are two major blood vessel that comes out from the heart and supply to the brain. But it will branch out many branch. But if the main branch is the one that block, so that will give a bigger, because if, for example, before it branch out, if the branch is the one that block, only small part of the brain is affected. But if the main branch is blocked, that means the bigger part of the brain will die off. So if the main branch is blocked, so it will give you a massive stroke. So means that it can also affect the worst. Patient can die because of the brain. It becomes swelling and all that, or they can lose their consciousness. They cannot wake up because affect their wake up. They call it at the one part of the brain where they controls the consciousness level. So if you want to ask what is the most severe, they can die from the stroke, or they can lose their consciousness, or they can also, another one, maybe they're aware, but they cannot move. That is the worst case of stroke. Yeah.
Okay, thank you, doctor, for answering the questions. So, is there any questions from the audience? Okay, no more questions. So, thank you, doctor, for answering the audience questions. We hope the audience enjoyed this amazing and interesting presentation by our wonderful speaker. The link for registration and e-certificate is now being shared for school students and UMS students. Please fill in your details and answer the simple feedback questionnaire. All students will receive e-certificate, while SDP point will be given to UMS students only. Thank you again to Dr. Alvin for the time to share with us, and thank you also to all the audience for your participation. We look forward to seeing you in the next 3S. Do not forget to follow us on Facebook and Instagram to keep you updated on the next session. It was a pleasure to have all of you with us on this beautiful day. With this, we conclude our webinar. Thank you for the cooperation and see you again.
Thank you.
Okay, thank
Well
you so much,
done. Thank you,
Doctor.
your science.
Okay.